Hello, Assalamu alaikum. It's me, Dr. Muhammad Naseem Shirzad. And today, the purpose of this video just to give idea that how I have written the things, how the NCPSP question they are asking the question, what's my approach, and how you should to approach the question. Like the things will not be very simple. There will be some confusing terminologies and word. You need to understand that, and that's need hard working and sincerity. For example, I just want to explain a single topic from a thorax chapter, that is trachea. For example, they can ask that the trachea is the continuation of the larynx and it begin at the lower border of the cricoid. Now they can confuse you by asking it they begin at the upper border, at the middle border of the cricoid. So you should be very clear that it is beginning at the lower border of the cricoid cartilage and it is the level of the sixth vertebra, and it is around 5 centimeter above the jugular notch and end at T5. So it begin at the lower border of cricoid cartilage. That cricoid cartilage is located at the level of C6 vertebra and it is ending at the level of T5. Why I have given this reference? Because there was some confusion in Snell, because many of the students following Snell. So for reference, always when there is a comparison or there is a controversy between Snell and Argilast, we are going to follow Argilast for all of the questions. The second things they can ask about the number of rank. There are around 16, 20. They can confuse you by giving 16, 15, 18, 20. So you should be clear that it's 16, 20, which is C shaped. The posterior aspect is empty, and this C shaped is actually a hyaline cartilage. The posterior aspect, there is a gap, and that is gap is covered by a muscle which is called the trachealis muscle, and the contraction of that trachealis muscle decrease the tracheal diameter. So a lot of information in these 3 or 4 sentences. Now coming into the size in unit is 4 centimeter and it is 10 centimeter. No need of concept, just to write it. And embryologically, they can ask you then when is the laryngotracheal birth. Why I have written? Because this is from past paper. There was a question on the shape of the thorax, and that is a newborn and infant that is actually a round shape when we are viewing it from above. I have also written the spine because they have asked that in some question that the spine of newborn is actually C-shaped with only one curve. The epithelium of the this thorax trachea is that of pseudostratified columnar ciliated epithelium, right? And the trachea is dividing into the primary bronchi, left and right bronchi, at the superior border of the pecthoracic vertebra. So you know this pecthoracic vertebra means the T5. We have already mentioned that the trachea is ending at the end of T5, right? And at T5. So again, same thing I have written so they can confuse you by giving this lengthy sentence. Now important of Carina, that is the keel-like ridge at the bifurcation of the trachea, that is a swelling-like structure which is the anterior posterior cartilage at the bifurcation of the trachea, and there was a question that this area is very sensitive and the cup reflex is actually started here which help to clear the sputum. So this is a past paper. Now this tracheostomy topic is a big, there is some confusion. Like they can ask about the nerve injury, the vein injury. But if they ask that what is the most common nerve injury during tracheostomy, that should be recurrent laryngeal nerve. But if they ask that what the most common vein which is injured during tracheostomy, that is inferior thyroid vein. But if they just gave you a clue of heavy bleeding, so inferior thyroid is not a reason of a heavy bleeding, but that should be anterior jugular vein. But if they ask the most common vein damage, so the most common is inferior. But if they ask the heavy bleeding, then your answer should be anterior jugular vein. So you know these wording carry difference. That's make a difference. The second is the tracheostomy cut down the space by 30 to 50%. And also there was a question regarding the arterial damage. But if they ask that the most common cause of like in child during tracheostomy, there is a risk of damage to left brachiocephalic vein, and right brachiocephalic trunk. So this is also a question. If they ask that in child during tracheostomy there is a risk of damage to left brachiocephalic vein, right, left brachiocephalic vein and right brachiocephalic trunk, left brachiocephalic vein and right brachiocephalic trunk. This is important. Now regarding the site, there is some confusion that which is the ideal site for tracheostomy in adult. So as a lot of now there is some consensus which I just want to change it in new edition. The ideal site for tracheostomy that is in adult, or if they ask overall, that should be second and third tracheal ring. So please make some correction here that the site of tracheostomy, if they ask in adult or overall, that should be second and third tracheal ring. But if they ask space, the space should be C2. While the site for tracheostomy in children, that should be 3 and 4 tracheal ring. But if they ask the tracheal space, then that should be C3 more than C4. You can remember by child 34, right? The second question they can ask during tracheostomy, one should not injure the tracheal ring, post tracheal ring, because it's very sensitive and an important structure area. During tracheostomy, the heat loss by evaporation, this is MCQs. Tracheostomy is of no benefits if the lesion is at the level of Carina. Again, this is MCQ. So you know from this single pages, a lot of MCQ. So you can't ignore any single page. I will also record some other